Good afternoon, everyone. I'm Sandra Arevalo. I'm the Director of Community and Patient Education, I was going to say, but we changed the name of the program and now it's Community Health and Wellness at Montefiore Nyack. I'm happy to be with you today with all of our attendees, and I'm happier, I have to say, to have our panelists today because we're going to be talking about a very, very important topic, which is the LGBTQ plus care and what we're doing to close the gap. And we're going to be discussing what's that gap, why is it important to have dedicated LGBTQ plus care, and we have experts with us today on both sides of the spectrum, people who need services, people who provide services, and definitely this is going to be a more than interesting discussion to have. So I'm just gonna introduce our panelists at this point, and I'm gonna go by one, asking you please to introduce yourselves, telling us a little bit about what you do, what got you here today, and that's how we're going to start. So I'm just going to start on my screen in the order that I have you on my screen. So Brooke, would you like to go first?
Sure. Good afternoon, everybody. My name is Brooke Malloy. I use she, her pronouns. I'm the Executive Director of the Phyllis B. Frank Pride Center in Rockland County.
Lauren?
Hi, my name is Lauren Klein. I'm the Director of Health and Wellness here at the Pride Center. Thanks for having me.
Thank you. Dr. Singh?
Hi, everybody. I'm Barry Zingman. I'm the Clinical Director for Infectious Diseases at Montefiore in the Bronx. I'm the Medical Director of the Montefiore AIDS Center and the Medical Director of a new LGBTQ-focused clinic in Nyack that I think we'll probably talk a little bit about. And I've been providing LGBTQ care, HIV care to people at risk for HIV for longer than I'd like to admit.
Mm-hmm. Justin?
Hi, good afternoon, everybody. My name is Justin Torre. I use he and him pronouns. I am the practice manager for the Montefiore Oval Center down here in the Bronx. We are the sexual health clinic for the hospital institution here in the Bronx. I'm also working with Dr. Zingman in the Nyack location. I am the interim practice manager as we start up our clinical operations and we start getting ourselves fully staffed and getting the community engaged and involved with our programming up in Nyack.
Excellent. So thank you so much for this. And, this time I want to note to our attendees that we would like to make this an open discussion with all of you. So if you want to use the chat box to send questions, to write down comments, same thing with the Q&A feature here. You just click on the Q&A icon and you can start sending us your questions. I'll be very happy to pass along those questions, read them to our panelists. And, we want to really encourage to have this live discussion and receive a lot of questions. So let's start by asking, why is it important that to receive appropriate health care or give appropriate health care to the LGBTQ plus community? Why can't you just go to a regular doctor and, be done with it?
I can definitely speak to that. I work with lots and lots of people here in Rockland County, who are part of the LGBTQ plus community, particularly the transgender and non-binary communities. And I think we already see the results of not getting good health care. LGBTQ plus people were more likely to live with disabilities, more likely to have chronic illness. It's like, I think here in the Hudson Valley, 50% of us don't have a doctor that we see regularly. So whether that's a primary care doctor, like maybe we're going just to the urgent care or the ER, or, maybe we're getting some of our healthcare needs met, via apps, or we're traveling really far distances for care. It just results in poorer life outcomes. Like, we have more mental health challenges. We miss more days of work. We, die earlier. Like, there's all these things that poor healthcare obviously leads to. And I think we're kind of seeing the negative side of that equation with our current, with the status quo, let's put it that way.
Yeah, and Lauren, why is that? Why is it that people don't like going to the doctor?
I mean, there's all the obvious reasons like that every person has of why they're scared to go to the doctor or it's not a pleasant experience. But there's been some research here, particularly in the Hudson Valley, that says that we have to travel really far distances for care. You know, anecdotally, I work with a lot of people, and like a lot of the people I work with, they travel to New York City, they travel to Westchester, they see doctors who only do telehealth because they're, you know, located too far away. I think there's that piece. And then there's also that we've had really negative and sometimes abusive experiences. And so there's some well-founded fear that we're going to be ridiculed or shamed or, you know, even like more than 30% of transgender people specifically have like been physically attacked or, you know, refused services, or, you know, they had to like educate their doctor about like what is a trans person before they could be seen. So there's like layers. I think everyone on this call might have a different answer of what they've seen of why people don't go to the doctor the way we should.
Well, there is a comment here and it says definitely also less doctors are knowledgeable and respectful, even ones in medical establishments that say they are accepting. So can you relate to that a little bit on what you see? Brooke, Lauren?
Yeah, I mean, there are certainly places that want to like slap a rainbow sticker on it and say, okay, we're good now, but you know, maybe they don't know how to ask for pronouns respectfully, or you know, the provider, if someone, you know, is like, I'm bisexual, they're going to be like, oh, well, that, you know what I mean? There's so many types of people in our community. And so, you know, maybe it's good for one segment, but is it good for everyone? Or, you know, all the intersections. You know, if I walk into a provider's office, I'm going to get a certain type of treatment, you know, because I have light skin, I'm educated, I speak very like professional, wellly, you know, so there's like I don't have any visible disabilities. Like there's all these like different layers to why it might not work. But yeah, it's so unfortunate. People want to put the sticker on it and like get our money and get our business. And there's not always been the work done to make it really safe and affirming. And I know that Dr. Zingman and Justin can speak to what the work is that has to get done to be really a place people are excited to go.
Right, and that's exactly my next question. Like, what are members of the LGBTQ plus community really looking for, you know, when they go to a doctor or a hospital? Like, what can we do to make them feel welcome and taken care of?
Can I just add something onto what Lauren was saying?
Please.
The last question. You know, I think it's become pretty obvious that LGBTQ care, really good LGBTQ care, is a specialty.
Mm-hmm.
It needs to be a specialty that the doctor, the nurse practitioner, the PAs, the nurses, the receptionists, the social workers, the patient educators at the site, everybody at the site needs to be actually specializing in it to be really good at it. Dabbling in LGBTQ care is going to result in a really bad experience, unfortunately. And it's not that those folks who are dabbling aren't well-meaning, but they can't really pull it off. And you know, and so, you know, I think, you know, and just going back somewhat to the experience with the HIV epidemic, HIV started out as highly specialized. there was an attempt to broaden it across primary care across the United States. It failed miserably because it's a specialty, because you're taking care of people with a special illness, a complex illness, who are often LGBTQ, often have mental health issues, substance issues, issues of homelessness, a low socioeconomic status. They need lots of support. It's a specialty. And if one doesn't recognize that from the practice standard, it's just not going to be satisfying for our patients. Gender affirming care is a specialty. And so yeah, unfortunately, it may be hard to find those places that really specialize in it and really keep up and hire staff that are going to be LGBTQ friendly and really into it. And but unfortunately, that does seem to be what people have to seek out.
Mm-hmm. Thank you, Dr. Stingman. And how do you become a specialist? I mean, I don't know of any schools that list LGBTQ plus care, the same as cardiology or, renal or anything like that. So what makes you specialist?
It's doing it mindfully. It's creating it with a mission and a vision, and it's keeping it going with that mission in mind. It's not just opening your door to any medical care and thinking you can be LGBTQ expert because that's 1% of your practice. It needs to be a major part of your mission, and to yourself through your own training, to your staff. It needs to be kind of a constant part of the environment and the training of the staff. It comes, I think it really comes from within to want to provide that and create that environment, a safe environment that is affirming to LGBTQ individuals, mm-hmm. and put in that commitment of time and effort.
Mm-hmm. So, I feel that the way that you're describing it's a matter of personality as well, that you have to be open, that you have to be empathetic, that you just have to have a good heart, I feel, right? Like you just want to provide a good service to everybody around you. Brooke, would you like to add something?
Yeah, it's really interesting when we use words like it's a specialty, and I understand why people in our community are put off by we aren't a specialty. We don't need something we don't need a specialist. We need every provider to treat us like human beings, and that's totally valid. And I also hear what Dr. Zingman is saying is that because of the way our overall society works, in the dehumanization of lesbian, gay, bisexual, trans, queer, non-binary folks, is that it had to become a specialty, like what you're saying, just like doing the right work, doing the right thing, to be very mindfully providing services, because it is not the status quo, or it's not the norm in our culture to value and to see LGBTQ people as humans, therefore give them the same care as everybody else.
Mm-hmm. Yes, thank you. And Lauren, you mentioned something. You said people travel long distances to seek care. Why is that?
I mean, I think the reasons that Dr. Zingman was speaking about, there certainly are some people who within the community who prefer to see, their primary care doctor down the street, who they may be their only trans patient or their only, out gay or lesbian patient, and that works for them. They've done that individual work to educate that provider, so that provider can provide them with the care that they're looking for. But the average person wants to walk into a medical office and feel comfortable. And unfortunately, here in New York State, and in the region, really, there are these specialty hubs, mostly in major cities, where people travel. Callan Lord certainly is one. There are a number of them in New York City that people, when you Google trans healthcare specifically. You Google, hormone therapy for trans people, like the thing that comes up is the Callan Lords, is the Fenways in Boston, the Mazzoni Center in Philadelphia. It is these large practices that specialize. And so people either don't, the thing doesn't exist in their local community, or they don't know how to find it. And so they do end up going to these large centers, which may be many, many hours away from their home. Yeah, I also want to speak to what Dr. Zingman was saying, that some people want to have like 1% of their patients or dabble in it. We did some research, and we gathered some feedback from people here in Rockland County. And one of the things they said makes good healthcare is that their doctors keep up with the latest medical science and use it to inform their treatment. So the science of how to get the best life outcomes for LGBTQ plus patients is changing all the time, just like any field of medicine. And it's common for doctors or for providers to get kind of stuck in a rut, and they've always done it this way. And maybe because it's only a small portion of their patient population, there's no investment by the larger organization to get them the professional development that they need, to attend the conferences, to read the journals, to really give us the cutting edge care that we deserve, that everyone deserves.
Mm-hmm. Mm-hmm. I also have a feeling that when you are from the LGBTQ community, there is certain sort of discrimination, and I'm sad to have to use that word, but I can't use a better one right now, even by other patients, right? Like when you sit at a waiting room and you just don't fit the standard look of everyone, is that just my impression, or does that have something to do with that as well?
I will say, particularly when it comes to breast and chest health, the idea that everyone wants to go into a building marked women's, where there are a lot of things that are pink, and there's a certain like, we're all women here together. That's really awesome for a certain segment of the population who needs those services. And then just a profound mismatch for another segment who also needs those same services. And the people don't go because it's not good to go and feel bad about it.
Out of place completely, right? Yeah. Okay, that's what I thought. So if I'm part of the LGBTQ plus community and I want to go see a doctor, and Lauren, you said this, you just place a sticker there, and the sticker is supposed to tell you, but it's not telling you the truth. So how do I really know who is a good doctor that I should see?
I guess that's really personalized. I mean, I could say for myself, like, I want to go somewhere where a doctor's not making assumptions. If you're a bisexual or a pansexual person, not making the assumption that if you are sexually active, who you might be sexually active with. It could be something as simple as, regardless of how you identify, being shamed about your weight, like going in and saying, well, whatever your issue is, you should just lose weight. I mean, that like I said, that doesn't matter about your identity per se. Sometimes it's just to have, you can find a provider that has the same lived experience, which is also very, very helpful. But it's really going to come down to whether it's personally for me or from who we hear from in our constituency is, are you using my name? Are you using the pronouns that belong to me? Are your forms inclusive? Really simple changes like that. Will you help me through my insurance process if there is a difference in the name that I use and what might be on my insurance documents? Are there things for that? And will I just be treated, am I going to be shamed around sex or my sexual activity? Am I going to be shamed around any of these things? Am I able to tell you all of the things that might impact my health outcomes. And those things can be personal, but I will always say it really starts with like treating somebody really authentically like a human being. And if there is a mistake that's made, thank you for telling me, making note of that, and then continuing on. And that's not just for the provider. That starts at the person you call on the phone to make that appointment. It's every single step. It's every person in between. It's the person that's taking your blood pressure to the doctor that you're going to see, and then when you're checking out, or anybody else that you might need to engage with.
Mhm. And
Can I
go ahead.
add to that? Yeah, no, thanks. I do think that there are hints that people can get in many different ways. Certainly the biggest is just word of mouth. A word of mouth recommendation that somebody had a good experience, or that a healthcare worker is recommending it because they know that people have had a good experience. That's number one, absolutely positively. But I think people can get other hints that may be more than hints. For example, does their website say that they provide gender affirming care? Does their website say that they provide LGBTQ care? Do they provide sexual health care? Do they provide HIV care? Do they provide HIV prevention care? They're pretty much, if you could find this information, there's a much better chance that that's going to be an LGBTQ friendly practice.
Mhm. So much more than the sticker. And I would like to read some of the comments because they are very interesting. So George says, I truly agree that gender affirming and LGBTQ plus care is indeed a specialty. There should be integration of this vital topic, not just a 1 hour lecture into nursing, medical, and allied health curriculum education. Many thanks. Then Kathleen answers, thank you. She says, as a person with disabilities and who identifies as bisexual, it's definitely difficult. I have a family member who identifies as non-binary, and they have high anxiety about going to doctors, largely due to their gender. And Everett says, I really believe that doing this work, there must be a spiritual awakening within one's personal being. Every medical practitioner should have a keen level of understanding of the LGBTQIA community. Many doctors, like people, come with preconceived ideas. These kinds of webinars are helpful and necessary to create safe and welcoming medical visits. So thank you for your comments. That's very nice of you, and thank you for participating. I love it. So, and we were just saying, Brooke, I think you were touching on the fact that sometimes at the very start, like just by asking what your name is or how do you identify, we already, it started on the wrong foot right there. So I guess Dr. Singman or Justin, you can explain to us, how do we gather data like that, about gender identity, sexual orientation in a LGBTQ friendly organization?
Sure, I can take that one. So, I mean, for us as a hospital institution, I mean, that has taken us years to be able to accurately collect data, but it has been a fight worth fighting, because as we know, as individuals, we want to make sure that there's visibility and that there is not just an other box to be checked off on, because when we label people as other, we kind of, again, remove them from the general population. So I think for sure what we're trying to ensure is that individuals do have visibility within their healthcare. So as Brooke had mentioned, if they see their identity or their orientation on a form, there's validation there. If they're able to go to a doctor's office and be addressed by their name, I hate using the word preferred, because again, individuals that are in trans experience, they're no longer preferring that name. That is their name. So that's just a little education for folks to have, that using the word preferred gets a little tricky. So for an individual, that we want to make sure that they're addressing them as their name that they are being identified as. So again, these were things that we had to do from every standpoint in an institution, from our medical records to our forms, to the way that if a patient goes inpatient, make sure that their ID bracelet addresses them as such. So again, it wasn't anything that happened overnight. However, when you have individuals within an institution that want to ensure that patients have visibility within their healthcare, there's going to be the fight that had. So again, making sure that our medical record system is inclusive of trans identities, making sure that we have sexual orientations that will match to the patient's preference, making sure that we have gender markers that we're able to, again, identify folks have. And then again, once we're able to get this information into the system, we now can pull that information in a very different way. So then we can start really teasing out exactly kind of trend data. So versus before, where unfortunately, most trans identified individuals, particularly trans feminine individuals, were identified as MSM, which again, problematic within itself because MSM stands for a man who has sex with men, and trans identified females or trans feminine individuals are no longer men. So to identify them as an MSM is actually kind of derogatory in that way. And it's now, instead of providing visibility, we're oppressing the population. So again, when we're able to start teasing out the information better and able to provide visibility to those folks, we can start looking at what our trans services are, who is accessing them, and how we can better serve those individuals versus just bunching people into these clusters that really aren't existent. Now, again, this is everything from federal level to state to city to local. It's a huge chain issue, but I know for ourselves, particularly our program, we are grant funded, and these have been things that have been fought on the federal and state level to make sure that we can have data collected accurately in these systems. So this way, again, we can find out what our populations need without having to kind of just say, oh, well, the general MSM population, that's incorrect. So again, we're just wanting to make sure that we have all the systems in place that regardless of somebody's identity, sexual orientation, gender expression, inward, outward, felt presentation, that all of that can be not only celebrated, but also validated and recognized.
Excellent. Thank you. Thank you, Justin. And we get another comment from George. I think this is a question. It might be a hard one, but we'll see. He says, are there any quality indicators and outcomes being utilized to inform LGBTQ plus evidence-based care?
So I can speak, certainly I don't know, intimately what Montefiore is doing, and I'm sure there is some quality assurance processes that are happening. At the national level, we need to participate as LGBTQ plus people. We need to participate in medical research when it's thoughtful, when it is being done by people from the community. There is a really important survey called the Pride Study, which gathers data on a very large number of LGBTQ plus people. There's also one aimed specifically at lesbian, bi, and queer women. So like there are these research studies that researchers can pull from these data pools to, learn things about our community and about our healthcare needs, where there are gaps, but there is rightfully so a lot of fear and hesitation to participate in medical research because historically we were like various populations in US history, experimented on, used as sort of guinea pigs for different types of treatments, or, we had to jump through a lot of hoops that researchers would put up before we would get basic medical care. So there is totally valid reasons for people to not want to participate. But we are at a point where there are trans people leading medical research. There are, lesbian, gay people leading medical research, and yes, fill out the Pride study.
Okay, no, but that's good to know actually that there are studies being done and that people are being asked these questions. And, I wish we knew more about those studies and we could learn more about it. It's yes, Dr. Singman.
Yeah, let me just add, so to the question about quality parameters that George asked, yeah, there are. They focus on issues that are highly prevalent in the LGBTQ community, such as, is there a sexual history being taken? Has there been STI screening? Are HIV prevention meds being given appropriately? Are people getting gynecologic services, mammograms, cancer screenings, anal pap smears, and so various different parameters of interest to the healthcare of people in the LGBTQ community, but then analyzed as well by gender and gender identity. So we've got and by sexual orientation. So to the extent that some of these may be measured across populations, but with the LGBTQ community, they need to be measured on the specific demographic level as well. And so that's how we turn generic quality indicators into being LGBTQ specific.
Is there any specific website or publication or anything like that where we can see those numbers? Or do you have to have a subscription to a journal or something like that, where we can have access to this data and learn from it?
I'm not aware that there's publicly published or any kind of systematic publishing of this level of detail. Let me just say we are funded by the Ryan White program for HIV care as just one part of this example. We are required as part of our quality work to analyze data to find disparities by race, ethnicity, gender identity, sexual orientation. So we do that analyses, but they are internal analyses that we share at our own quality meetings. I don't know that there's, and I'm sure people are presenting their data at conferences, and I'm sure there are publications, but I don't know that there's really any kind of like systematic way that I'm aware of to actually find this. There's certainly no national database or anything. It's all on a place-by-place basis.
We should start an LGBTQ plus care journal then, with all this research and all of that. That way people can learn more about it.
Also, I am like a magpie for data. I collect data. I love data and research. If anyone who might be on this call is part of a journal club and they would like recommendations, or we
start our own journal after this, who knows?
You know what I mean? Like, I collect and gather lots of data and research studies, and I can point people in the right direction. Maybe we put my email address in the chat. Certainly any medical providers that are, listening in, like, I'm happy to, or researchers or whoever might be here, I'm happy to point people in the direction of the latest research.
Well, and thank you for that, Lauren. Thank you for offering. And we have another interesting comment going back to the name change and all of that. Individuals who haven't legally changed their name can ask that a note be put on their chart, as well as if the person prefers to be referred to as they, them. It helps greatly when doctors use that. And a comment from Jessica, there is a difference between a specialty like a primary care or endocrinologist versus a gastroenterologist. Primary endo, I will need to make sure the doctor specializes in LGBTQ gender affirming care for my non-binary child. Gastro doctor, a flag on the website, LGBTQ friendly might be enough. How can we ask when calling a provider office to make sure they specialize versus double? That's a good one.
That is such a good question. I'm just going to answer from the community perspective, is that there really is no way to know unless you hear from your peers what they've experienced there. And even that would not be consistent throughout the entire LGBTQ plus rainbow. But if you want to talk about what doctors are trans or non-binary, competent, friendly, affirming, that there are, as I've learned, the trans and non-binary community speaks to one another on a national level, on a very local level, to say that these are the doctors, specialists, whatever, that we've vetted. Here are the experiences that we have had. And that could be from gender affirming surgery, but also like what you're saying, gastroenterologists and all these things. And I guess depending on where you live, it might be difficult to get that kind of a referral. But certainly if you live here, you can call us and we could poke around if we don't already know. But once again, it's really going to be about somebody from the community going and having an experience. And then at the same time, you might find people that do come from the community. One person has a wonderful experience and the other person's like, that's not for me. So it really depends on what affirming looks like for you. Certainly proper use of name and pronouns is the most basic, but like Lauren was saying before and others, being up to date on the latest medical care is something that you definitely want to know, and that many patients may not know what the latest standards of care even are. So it's education all around.
Mm-hmm. And
let me just mention, because I know that this sometimes can work, particularly if you're calling up for an appointment at a place where there are multiple providers of care. Sometimes simply asking the secretary, I'm trying to get a gynecology. Can you schedule me with somebody who's particularly known to be LGBTQ friendly? Like sometimes even that at the front desk, they will help you to get connected to the right person. It's worth trying.
Yeah. That's a good idea. And going back to the data, here is another comment from Caitlin. I often participate in surveys of different types and sign petitions. More often than not, they have required questions with only male, female, and specific racial questions. I detest the binary gender answers as well as typical racial responses. The world still has a way to go. Yes, it does. And
that definitely is true. And I do want to always put out there that even if, and this might sound contradictory, it's just because it's very, very nuanced. You could have a form that asks and looks like all of the right questions, but then when you sit down with the provider, anybody in that practice, or really anybody in any system, are they really carrying through on what they're showing, like outside of the questions that they're asking?
Mm-hmm. Yes. Now, we're here in Nyack, and even though we're so close to the city, we still lack so many services, and sometimes, working in the community, with the community and for the community. Myself, I feel that sometimes we lack a lot of resources, even though, the biggest city in the world is right next door. So what is done right now in Rockland County? What is Montefiore Nyack doing in order to help this situation and provide better care for the LGBTQ plus community?
Justin, why don't you take that?
Well, thank you for that. Sandra, just one more time for me, just because as I'm collecting my thoughts to respond. What was the question?
What is, even though we're right next door to New York City, we lack a lot of services here in Nyack, and sometimes it feels like we're an underserved community, even though we're so close to the greatest city in the world. So especially when it relates to the LGBTQ plus community, right? Like Lauren said it, people have to travel long distances to be seen by a doctor that is worth, going to visit and paying the gas and the toll to go there. So what are we doing right now here in Rockland, and specifically what's Montefiore Nyack doing in order to help to close that gap?
Yeah, so I think first and foremost, us opening a LGBTQ primary care location clinic for folks is kind of first steps, just because, it seems that there is a lack, particularly within the area, to have a very specific LGBTQ plus primary care location for folks. But also, we get into transportation needs. We get into a lot of other barriers that come into play for folks. We talk about New York City now. Granted, there's a 24-hour subway system in New York City, which obviously allows travel and access to be a little bit greater. Once we get outside of the city, things become a little bit more limited with bus or train or et cetera. So again, transportation is a huge barrier for folks. So that's step one. So again, for us, granted, where we are in Nyack may be a little bit a ways from some folks, but it's hopefully avoiding a toll. Hopefully it's avoiding a little bit more highways. Again, it's bringing the services a little bit closer up, but then also the idea is working with other agencies throughout New York State. Like I know there is Trillium Healthcare. They are huge in upstate New York and Rochester and other places. We know that there are other places that are doing more expansive work, particularly for the LGBTQ IA plus population. So, again, it's ensuring that we as Montefiore are not trying to come and, stake claim and say we are the best to do this. We are one of the best to do this. We know that there are other places that, equally or as well, or can provide just as good care. So we want to make sure that, again, if we're a location barrier for folks, we want to work with folks to make sure that we're going to get them to a place that's closest for them, that works for them. But then also, granted, pre-COVID, telemedicine was kind of a thing that was new. It was interesting. People were excited about it. And then COVID hit, and then we had to provide telemedicine. There was no ifs, ands, or buts about that. So I think, COVID forced us to be smarter in the way in which we provide medical care for folks. So now we have the ability that if we see somebody for a new patient appointment in person, moving forward, if there's no really great higher needs, we can now start doing telemedicine with them moving forward. And again, that's going to remove the barrier of transportation. That's going to remove the barrier of having to take off of work, missing school, childcare, et cetera, et cetera. So now that we have access where we can actually be in people's homes with them to provide the care, I think, again, we're now doing much more to ensure that we're bringing the service to the folks versus the folks having to actually physically come to us. Now, again, this does get tricky with being able to do certain services, but again, where we are right now with telehealth and telemedicine, we are eliminating some of those barriers for folks. So I think, again, first is creating the space for individuals, then it's actually being able to have the services available to folks where they need to have it.
Mm-hmm. Thank you, Justin. And you just mentioned something that got my attention. You mentioned primary care. So how is primary care for LGBTQ people different in this clinic than in other clinics?
Yeah, absolutely. So I think for us, when we say primary care, we're trying to look at the whole person. We're looking not only at the physical self, we're looking at the mental health of an individual, behavioral health, substances that are being used. So again, we want to look at the person as a whole versus, just saying, hey, we're just going to do medical with you. We need to send you to point B for mental health. We need to send you to point C for substance use care. Because again, once we start having folks having to kind of jump from provider to provider for different services, you start losing individuals in those transitions. So I think, again, having services as kind of a one-stop shop model where we can take care of the whole person, one, definitely promotes wellness in a different way, but also two, allows individuals to get their care from their trusted providers in one space. So again, if I have a provider like Dr. Zingman, who, is a great medical provider, and then I have someone like Lauren, who is a wonderful, individual that navigates individuals to things that they need, or then if I have a social worker that understands the need of LGBTQ folks, again, we're now providing a different type of service versus a primary care location for non-LGBTQ folks where, again, there's been this idea of it's the 15 minutes with the doctor and that's all you have. We know that that's insurance-based. We know that there's some institutions and some practices, that's their policies. But I think for us, we understand that people need a little bit more than 15 minutes with a provider. People need a little bit more care. People need the availability of, hey, I'm sitting with a medical provider. I'm actually having a mental health crisis. Let's bring in the social worker. Let's make sure that they're involved. Let's take care of everything we can possibly take care of. So again, I think, primary care for LGBTQ folks looks a little bit different because of the value of mental health, because of the value of sexual health within that nature. Dr. Zingman mentioned about the AIDS pandemic and the epidemic that, late 80s, early 90s. Again, these were all things that the gay population or LGBTQ population at the time were facing with. And again, we're meeting with discrimination, we're meeting with judgment, we're meeting with stigma. But now we have the ability to provide stigma-free and judgment-free care to folks, not only from individuals that understand, but also individuals that are part of the community. I'll use myself as an example. I am a proudly out gay man. I have the understanding of what it feels like to be a patient receiving medical care as a gay man, but then I also have the humble ability to be able to be a provider to provide LGBTQ specific care. So again, we have individuals that have experienced the lack of interest, the lack of visibility, the lack of taking care for some folks of this population, to now where we're going to staff our clinics with individuals that care for the population, that are from the population, that have wanting to work with the population. So again, the population comes to a place that they can call home. Because as we know, individuals, when they're interacting at school, at work, at the grocery store, there's stigma and discrimination hit at every point in a person's life, whether they are gay, whether they are trans, whether they're bisexual, whatever the case may be, there is kind of discrimination and judgment hit at every point. So again, if we can be a secondary home for folks, we know that people have their chosen family, and now they have a safe place where they can be their authentic selves. We are actually helpfully kind of improving the general well-being of individuals of LGBTQI+ experiences.
Mhm. And
Yeah, I was just going to add, that was beautifully said, Justin. I was just going to add, and I guess reinforce that in LGBTQ primary care, there's going to be a whole lot of extra focus on you as a person, on your identity, your contacts, your partners, your family structure, in a much more accepting, open way. And then how does all of that contribute to your health and well-being as well? So there's going to be just a much greater focus on those aspects of your life and your health than normally one would experience if they were not going to an LGBTQ friendly practice. And let me just step back just for a second, just in case anybody doesn't know, the Montefiore AIDS Center, the Rockland Pride Center, and Montefiore Nyack Hospital have developed a tremendous collaboration to create this new clinic site in Nyack. And look at that. And just to understand, this is a tribute to the Pride Center for seeking out partnership to be able to fill gaps in medical care to the LGBTQ+ community. It's a tribute to Montefiore Nyack for taking up the challenge of doing this, and then reaching out to us at the Montefiore AIDS Center and also at our Oval Center site to help provide some of the expertise. And we're really happy with who we've been able to hire so far. The initial feedback from our patients over the last few weeks has been tremendous, and we really look forward to deepening our collaboration with the Pride Center, Montefiore Nyack, and the community.
so thank you, Dr. Stigman. And so that everybody knows, the Jacobs Family Pride Wellness Center at Montefiore Nyack Hospital opened 3 weeks ago. It's a baby. It opened 3 weeks ago on at 312 Route 59. And these are our providers. So Dr. Stigman being at the head of them. But maybe you would like to introduce, maybe Dr. Stigman, you would like to introduce some of the other providers that are going to be working in our Pride Wellness Center?
Absolutely. So we're there now 2 afternoons a week. We expect to be growing as space more space becomes available, and as more patients come to see us, and there's the need. So we are filling out our staff. We have an initial staff who are all LGBTQ friendly, many of whom are LGBTQ identified in the community. And Dr. Ralph Bernardo, for example, is an attending physician, infectious disease specialist, a specialist in LGBTQ care, and who's working with us in the Bronx for a number of years. I think I could say it because I know he would. He and his husband are very happy to have a just under 1-year-old child, a beautiful child, and he lives in northern New Jersey, and is coming to the Pride Center clinic and loves to be there, and is an incredible physician. And then Hilda Ortiz Morales has been taking care of LGBTQ individuals for her whole career, is a specialist in HIV care, in gender affirming care, and nursing care. Karen Weiss is a nurse practitioner. She and her wife live in Westchester County, I'm pretty sure. She and her wife live in Westchester County, and she specializes in gender-affirming care, sexual health care, LGBTQ care, HIV care. A very experienced nurse practitioner who's an incredible person, incredible resource for us. And so this is the start. We're going to be adding more as we grow. And maybe Justin, you can talk about Justin or Sandra, talk about the other staff who are there at the clinic.
Oh, yeah, absolutely. We have other staff, we're trying to create a big family. Really, that's what it feels like, because we're working under the premise that what really, you can learn a lot of things about science, but you cannot learn a good personality. So we're definitely forming a family that is very understanding, welcoming, empathetic of the LGBTQ plus community. And we're very happy to have this new clinic open. And here you see some of the services and treatments that we have. This is just a start, I have to say. We envision that our services and treatments are going to grow a lot wider, longer, and faster as well. And we're going to be able to serve the community in every way. Yes, Lauren, go ahead.
I saw a question in the Q&A, and I'm so excited to say they are doing hormones using an informed consent model. Yes,
I was just
very exciting.
Yeah, exactly. So that's great as well. I mean, again, it's a small clinic for now, but we're very happy that we have the right providers and the right people, and that we really want to have a space where everybody feels safe and welcome and happy, and that is well taken care of, Okay, so where is the clinic? The clinic is right here, location 312 Route 59. And Dr. Sigman already said the hours of the clinic. And, I think that we cannot stress enough that this has been a collaboration between Rockland Pride, Montefiore Nyack, and the Oval Center at Montefiore Bronx, because, it's been teamwork to be able to put this clinic into place. So let's see at the comments, because now they're like, it's so many comments and we only have 4 minutes.
Sandra, I saw a really good question about adolescent care.
Oh, go ahead, because I can't keep up.
Yeah, let me just pick out that one, particularly since I have such a positive answer for it.
Go ahead.
So our medical providers can care for people 16 and up, and for people right at that site. For people under 16, we would have to refer them to other physicians who specialize in younger adolescent care. That is much more specialized, but we have some fantastic people to see them. Not at the location in Nyack, at least not yet.
Yeah,
I like that answer, Dr. Zingman. Not yet is the key, because know the Pride Center, Jessica. I know you answered that question. It's one of the #1 calls we get every week, are for those that are under the age of 16, particularly around puberty blockers and other options. So we know that it is a priority, and we're working with the team to make it a reality here. Yeah,
we're definitely referring out for now. So we are referring to good care. But the dream, or I don't like to call it the dream, the goal is definitely to have the services on this side of the river. So parents can call the clinic for referrals, yes, and yes. So
or the Pride Center itself.
Yeah, the Pride Center itself, exactly. You can receive primary care and get all the referrals that you need, and on the other side, yeah. Okay, I don't even know if we have time for more questions or comments. We have 2 minutes left. So any last thoughts from any of you, Brooke, Lauren, Dr. Sigman?
We're going to put down the Pride Center's contact information here. And then for those of you that, because it is such a small community, it's an important reminder that if you do choose to get your care at the Jacobs Family Pride Wellness Center, that it does not mean that the Pride Center staff would be privy to your personal health care business. That's not how it works. In a small community, that's always a worry. It's literally a handoff, and we wouldn't even necessarily know who the patients are unless that's something you wanted to disclose to us. But we're going to put, all right, Lauren already did. I'll put my information as well. And either way, you could call either place.
Yes. And so that people know, I like what you said, Brooke. This clinic is very private. You know, obviously it's just like any other hospital. All your information is private. It's HIPAA all the way. So nobody has to feel, you know, unsafe coming here. Okay, Lauren, any last thoughts?
This this wellness center has been a very long time in the making. The relationship with Montefiore Nyack goes back more than a decade. I personally have been involved in seeing this wellness center happen for like 5 years now. It's amazing. I'm extremely proud that it's finally here, and the team that's here, and Dr. Zingman and Justin and Carlos Roman, the health educator, and the other staff that are coming on, you know, each day. It's really amazing. It's a really great option here for our community. You know, where there really was a challenge of where do we go and who do we see, and you know. So I'm just like so proud and excited to see people being able to access care close to home.
Thank you so much. Dr. Singman?
Yeah, I just wanted to add, you know, as the medical director of this new clinic, my commitment is to create a fantastic LGBTQ clinic for Rockland and the Hudson Valley. That said, it has to be really high quality. It has to be done really well. We don't want anybody to be coming in and having a poor experience. So that means controlled growth as well, making sure that we hire the right people, that we have the right space, we have the right environment, that we have the right expertise, that we grow as we are able to provide not just dabbling care, but excellent care in anything we provide. So I just always am stressing growing carefully, growing with expertise.
Exactly. And you know, I think Dr. Singman, you mentioned this at some point during our conversation. You said word of mouth. So, you know, we're not making a huge display. We're not on the news. Maybe we will be soon, but like right now, we're just looking to be word of mouth. Like, you know, now you know about this. If you would like to try our services and then recommend our services to people you know, that's how we would like to grow really as a family, you know. So we run out of time. We're 2 minutes over time. Every time that I do something on LGBTQ, this happens, because I have the best panelists, very knowledgeable. Thank you for always putting your heart on everything that you do, all of you. Thank you. And thank you to all of our participants. Great comments, great questions. I can't wait till we meet you, maybe at the Jacobs Family Pride Wellness Center at Montefiore Nyack. So until next time, thank you.
Thanks, everybody.